have neck pain? Do you feel that your muscles in your upper back are tight? Is this a symptom of normal or usual neck pain or a possible symptom of arthritis in the cervical spine, known as cervical spondylosis, especially true if you are more than 30 years old? This video here will guide you. Plus, I will also share with you the 5 things that you can do at home to instantly get rid of the neck pain fast. Stay with me until the end because you don't want to miss out on any of this important information. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. I have seen a patient who complained of neck pain and after several weeks complained of numbness in the arms and in the hand. An MRI eventually showed that there is already nerve involvement. That's why in this video, I will teach you the 5 symptoms of possible arthritis in the cervical spine, known as cervical spondylosis, and the 5 things that you can do effectively at home to get rid of the pain fast. I will also answer commonly asked questions regarding neck pain and when is this considered a medical emergency. Why do you experience neck pain in the first place? The most common contributing factor for this is wrong posture, especially true if you're always using your cell phone, your laptop, and your computer in a slouch position. This is actually one predisposing factor for a diagnosis of cervical spondylosis or arthritis affecting the neck. The wrong sleeping position can also give you neck pain, especially true if you are sleeping on your stomach because this positions your neck in one side only. And if you are using the wrong height of pillow, which I will also elaborate on later. Stress can also be a contributing factor for neck pain. Do you know that every time you're stressed out, your neck and upper back muscles tighten? It becomes hard. There is limitation of motion causing pain. Changes in the spine caused by aging. That's why these had been linked for those over 40 years old and above. However, recently, we have had younger patients because of assuming the wrong posture all the time. Here are the 5 symptoms that will guide you if this is usual neck pain or a possible diagnosis of arthritis in the neck. Pain in your neck plus limitation of motion, especially when you look up or with cervical extension. You will feel a restriction in your movement when you look up. This motion is most limited with neck osteoarthritis because of the changes in the spine, especially in the presence of bone spur formation, which is linked with osteoarthritis. You can also observe limitation of motion every time you rotate your neck to the right or to the left. And there is also limitation of motion when you laterally flex your neck like this or when you bring your ear to your shoulder. You can feel restriction on those movements. You can also hear sound, which is termed as crepitus, every time you move your neck. Stiffness and pain that is usually more pronounced early in the morning. This is one actually distinguishing factor of osteoarthritis. We can also consider possible cervical spondylosis if you experience numbness and tingling sensation in your arms and in your hand. And lastly, if you notice muscular weakness in your arms and hand. Please comment down below which of these symptoms have you experienced. If you have experienced symptoms number 4 and number 5, this means that there is possible nerve involvement. To help you, this is what you're going to do at home. You will be needing hot compress. You can use any hot compress that you have in your home, but I recommend this one to my patients simply because it is lightweight and it is flat. It can contour to your upper back muscles. The purpose of the hot compress is to help you with the pain naturally. At the same time, it can help with the tightness of your muscle by improving blood flow in the area. What you're going to do is you just drape this one over your neck and over your shoulder. These will cover upper back muscles. You use this for 20 minutes. For those of you who have elevated blood sugar, it is very important that you wrap your hot compress first with a cloth. Then using your hand, you try to palpate your skin if it isn't too hot for you. This way, we prevent burns because in long-standing diabetes or elevated blood sugar, sensation is impaired. Very important to prevent burns and even infection. If you want a hot compress like this, I will put the link in the description box below. That way, you can check on it. What's also good with this hot compress is it has a timer, so you can already set it for 20 minutes. For neck pain, you do chin tuck exercise. This is one of the best exercises which have been clinically proven to decrease the pressure in the cervical spine. And you can do this while seated or even standing. So to do chin tuck exercise, you simply mimic a double chin. You bring your chin inwards like this. You maintain this position for 7 seconds. You relax. And then you repeat it again 10 times. You can do this even while you're watching TV, and you can do this as many times as you want because this is safe and this is effective. Shoulder blade exercises can also help. These will directly work on your posture, at the same time work on your chest and your upper back muscles. So to do this, you can either sit down or stand up. What I want you to do is you imagine placing a paper in between your shoulder blades and then you squeeze it, maintain it for 7 seconds, relax, and then you repeat this one 10 times. This is safe and this is effective. One of the best investments that you can do if you're currently having neck pain or if you have been diagnosed with cervical spondylosis is to use orthopedic pillow because the wrong pillow height can actually cause you neck pain. You can purchase any memory foam or orthopedic pillow near your place. At home, we are using the cervical pillow because this can actually support the arch in your neck, at the same time provide proper neck support, and it maintains the proper height that is needed to put your cervical spine in neutral position. If you're interested with one like this, I will put it in the description link below, or you can purchase any orthopedic pillow near your place. Now, for ergonomic changes, this is very important, especially if your work entails sitting in front of the computer almost all throughout the day. What you need to do is to position your monitor screen at eye level. And this also holds true every time you use your cell phone. This way, we will prevent the slouch posture, which can actually worsen your symptom. Here are the commonly asked questions for neck pain or cervical spondylosis. Is cervical spondylosis dangerous? Yes, it is dangerous, especially if we have nerve involvement. However, in majority of cases, it can be managed conservatively. Is neck arthritis and cervical spondylosis the same? Yes, they are the same. Cervical spondylosis is a medical term that we use referring to osteoarthritis in the neck or in the cervical spine. Can cervical spondylosis be treated? Yes, in majority of cases, it can be managed through physical therapy, exercise, and even posture correction. When is it considered a medical emergency? Neck pain or cervical spondylosis is a medical emergency if you have neck pain and you experience loss of balance. Plus, there is loss of control when you urinate and defecate. This is a medical emergency because this means that we have a possible spinal cord involvement, and this needs to be addressed immediately to prevent paralysis. I hope that this video had been able to guide you. If you have reached the end of this video, please comment neck and your age in the comment section below. That way, I can make more videos which would be more helpful for you. If you want the #1 go-to vitamin that can help with numbness and pins and needle sensation, we have a video here including its natural food sources. Check on it. It will greatly help you. This is again Doc Sherry. Thank you very much for watching. I will see you on our next video. Stay healthy, stay active, because health is wealth.